Dental implants are a godsend. They allow people to have options for their teeth that 30 years ago just weren't there. Dental implants have been around about 30, 35 years. They became really mainstream about 10 years ago. And for most cases, when someone's got a missing tooth, an implant is the way to go. I had a guy just this morning. We did an implant on him, a few months ago, and put the final crown on the implant today. He's missing a lower first molar down here. And in days past, when I was in school, the only way to replace that missing tooth was with something that came in and out, kind of looks like a fishing lure with all the hooks and stuff. Or to put a cap on the teeth on either side of that gap, even though in his case, the teeth were in perfect condition. I would have felt really bad touching those teeth to do the cap, the crown on them that the bridge would have been connected to. The bridge is what we would have done. And that would have been fixed in place. It would have been cemented down. He couldn't take it out. But now he's got a tooth there that's put on top of this implant, and the implant basically it's an artificial tooth root made out of titanium. We put it down there. The bone has to grow in. I'm going to use hand skills here, in and around the implant. That takes a couple months. Then you can build something on top of that. Excuse me. Build something on top of that implant, and you attach a crown to that. And when you're done, for single tooth cases, that person treats that just like they would their normal tooth. They floss around it, keep it clean with a toothbrush. We treat it like that when we're checking their teeth, doing their cleaning. It's just like they grew it, except it has a titanium tooth root instead of a normal tooth root. For bigger cases, things get more complex fairly quickly. For people that have no teeth, there are many options. Dentures with an implant, well, at least two implants underneath it to help hold that denture down so it doesn't rock and move. The more implants you get in place, we can edit that burp out, can't we? The more implants we get in place, the more likely that you can have a case that doesn't even come in and out, no denture, something that's actually fixed in place, implants under that hold it, so that person basically has what look and feel like their natural teeth back. And so implants can be used for big cases like that, 1 or 2 teeth missing, 6 or 8 teeth missing, the rest of them fine. We just do so much with dental implants. A little bit on the process. When we take a tooth out, it's really best that the day we take the tooth out, where the roots used to be is now just an open, we call it a socket for obvious reasons. We put some material in there that helps new bone form in and around that socket so that socket maintains its shape and size. If you don't do this, and we call it a bone graft or a socket preservation, if you don't do that, let's say this was where the tooth came out here and this is the bone here. Well, if you don't do this bone graft, that bone starts to shrink away, both in height and in width, and it'll lose a bunch of its volume just in the first few months. You need as much bone there as you can to put an implant down, because the more bone there is, the happier the implants are. You've got to put an implant in solid bone. So take a tooth out, do a graft there, let that heal, usually a minimum of 2, maybe 3 months. Then we place the implant in that where the tooth used to be. We make a very small incision, make a place in the bone for the implant to go, close that up and put the implant in, of course, close that up and let it heal. Then once it's healed and the bone grows back in and around the implant, then we can uncover it and build on top of it. Now, people get a little turned off about this, or you're going to drill a hole in my bone. And that does sound kind of drastic, but everyone tells me that that part was a whole lot easier on them than the extraction in the first place, that they had months or perhaps years earlier. That the making of the place to put the implant is a whole lot less traumatic than the extraction that preceded it. So it's really not something you need to worry about. It's surgery, yes, but it is fairly minor surgery, is placing the implant. Once it heals, we can build on top of it and have something that's as good as what nature gave you years earlier. Few questions. Sometimes we can do a temporary tooth immediately on an implant once we place it. I don't like doing that because it stresses the implant potentially, and you increases your chances of having problems with that implant if you do it. So usually, in most cases, I like to just leave it be and put something over it that's not going to be touching the gum tissue. But implants are a great service. I'm so glad to be able to offer that. Here in my office, I do some of them, and I bring in a specialist to do some of the other ones. Between him and me, we get pretty much everything covered.